What steps have you taken to protect both the caregivers and the patients you serve, Mike?
Great question, and it's first and foremost to what we are thinking about as well. So one of the things we did, Bo, from the start, we established a command center very quickly with all the key leaders across the organization so that we could respond quickly and make decisions across the organizations on a whole host of things. We meet twice a week to talk about it. As I mentioned, we had to very quickly procure PPE for all of our, particularly our patient-facing, our caregivers, our nurses, our dietitians that are interacting with patients. And not only did we have to make sure that they had the appropriate PPE, that we also had to make sure our patients and their family members that are typically around during a treatment session also were effectively protected. And so making sure that our caregivers and nurses had the right equipment. And some of those therapies, Bo, last for hours, up to 6 to 8 hours. So being comfortable and making sure that we had the right equipment was key for them. And again, in the workplace, we're clearly making sure everybody is masked and wearing masks. We're taking steps around social distancing and figuring out how we need to configure our workspaces for that. And one of the ways in which we're keeping people safe is, as I mentioned, leveraging technology so that we can virtually educate, train, transfer patients where before we would normally do that person to person. And so as we transmit and transfer people out of hospitals using technology similar to what we're doing right now to help educate them.